This scientific program is on aging, different aspects of aging. And since I am in biochemistry, I deal with every aspect of health and disease at molecular level. So we will have a brief discussion of how telomeres are related to aging. Now, before we go into the relationship between telomeres and aging, I think we will have to recapitulate what we mean by telomere. Telomere is a part of DNA. DNA, you might have forgotten, is a double-stranded molecule in which 4 different bases are present. And there is a base pairing rule. Adenine can pair only with thymine and cytosine can pair only with guanine. But these 2 strands of DNA are then twisted around each other to form a double helix. And the entire DNA of any living organism is present in chromosomes. And the end of the chromosome, the terminal part of the chromosome, is known as a telomere. And this telomere has got a fixed base sequence, a 6 base pair sequence, which is repeated again and again, a number of times. And we know that every organism possesses certain genetic characteristics which are present in the DNA of the organism. And when a cell divides, the daughter cells receive an exact copy or exact replica of the DNA of the parent cell. And that's why the DNA which is synthesized in the daughter cells, the process is known as replication of DNA, because the new DNA in the daughter cells is an exact replica of the parent DNA. Now, we identify different DNAs on the basis of their base sequence. So on top we have parent DNA having a certain base sequence. And when 2 new molecules of DNA are synthesized, the base sequence is exactly identical. So new DNAs are a replica of the parent DNA. Now, this process of replication, this DNA is a polymer. It is a polymer of deoxyribonucleotides. Now, when new DNA is to be synthesized, the 2 strands of the parent DNA are uncoiled, they separate, and then each strand acts as a template on which a new strand having a complementary base sequence is synthesized. So on the left extreme we have parent DNA in red color. The 2 strands separate, then each strand acts as a template, and on this template you can see the yellow portion, which is the new DNA strand. And then 1 parent DNA strand and 1 new DNA strand form a new double helix, which is a daughter DNA. And this is how DNA is synthesized. Now this DNA is synthesized from deoxyribonucleotides, which are the building blocks of DNA. And this polymerization reaction is catalyzed by an enzyme known as DNA polymerase. So DNA polymerase polymerizes a large number of deoxyribonucleotides to form a new strand of DNA. But this enzyme DNA polymerase has got a serious limitation, a major limitation. In the top diagram we see the parent DNA, 2 strands have separated. Each strand is going to act as a template. 2 mononucleotides, which are the building blocks of new DNA, are in place, but DNA polymerase cannot join 2 free nucleotides. DNA polymerase can add a deoxyribonucleotide only when an oligonucleotide is available. Oligonucleotide made up of 10, 20, 30 nucleotides. The problem is, from where are we going to get this oligonucleotide? Because without oligonucleotide, DNA synthesis cannot commence. So here the nature has taken care of this problem by beginning the DNA synthesis with ribonucleotides instead of deoxyribonucleotides. Ribonucleotides are polymerized by a different enzyme known as RNA polymerase. And RNA polymerase can join 2 free mononucleotides to form a dinucleotide, and then an oligonucleotide can be formed. So this red portion is the oligonucleotide formed from ribonucleotides, which is known as an RNA primer or just primer. And then deoxyribonucleotides can be added to this RNA polymer. And when a sufficient number of deoxyribonucleotides have been added, the primer is removed. And now these deoxyribonucleotides, they will act as oligonucleotide, and the RNA primer is replaced by deoxyribonucleotides. So the process has to start with the formation of a primer. Then a problem comes in eukaryotes in multicellular organisms like human beings. The end of the chromosome or end of DNA is known as telomere, as we have seen. And this telomere has got a 6 base pair sequence which is repeated again and again. But the problem comes during replication. When the replication machinery reaches the end of the chromosome, that is telomere, or we can say even the end of the telomere, the number of bases which are left at the end of the telomere are not sufficient to form an RNA primer or an oligonucleotide. And if oligonucleotide cannot be formed, deoxyribonucleotides can't be added. So the end of the telomere cannot. Here goes below this critical limit, DNA cannot be replicated, and then the cell cannot divide. And when the cell cannot divide, it undergoes apoptosis, that is programmed cell death. Now the solution to this problem of preventing telomere shortening is that if we can add a few nucleotides to the end of the telomere, then we have sufficient basis for the formation of the oligonucleotide. So telomere shortening can be prevented. And this in fact does happen. There is an enzyme known as telomerase. This, for synthesis of DNA or RNA, we require a template. Without template, DNA cannot be synthesized, RNA cannot be synthesized. But this enzyme telomerase possesses enzymatic activity of polymerase activity, and it has also got a short strand of RNA which is going to act as a template. So this at present we do not have any method.
You said you can add nucleotides in order to increase the length of the telomere.
Yes. But that activity is lost after birth. It is only in fetal life.
So after in normal aging process, you cannot add nucleotides.
No.
Let me rephrase Shiv Gautam's question.
Yeah.
What is the practical day-to-day life translation
my-
of what you have just said?
Might only. Might after.
The present situation is that we can't prevent aging.
Okay.
Of course, we have got a number of factors, antioxidants. They also affect cell life. So if we prevent or we can decrease the exposure to oxidants, that can delay the process, but it cannot prevent the process.
Can we save these cells nuclear? Can we save them for more period and they can be used later on?
Saved outside the body? Yes, that is being done.
Placental.
No, stem cells are being preserved to be used later.
We can have a little more discussion in the open house at the end. May I request Dr. Shiv Gupta to please talk on non-communicable diseases.
Honoring us to invite over here to speak on a very relevant and emerging topic of the day in this country and in this part of the world. I'm going to talk a bit simpler things rather than what Ramesh talked complex things. We were never comfortable with genetics, DNAs, or RNAs, ever. But we could understand many things with this presentation. Mine is a bit simpler, and I come from public health. So you will see more of public health, more numbers, and more concerns for policy and programs aiming at preventing, reducing non-communicable diseases, mortality and disease burden. So that's what our concerns are in this part of the world, especially in India. So these non-communicable diseases are now an emerging threat in India. What was seen in United States and the Western world in 1950s, and then it grew into an epidemic of chronic diseases, CVDs, COPDs, hypertension, diabetes. Now the same is there. This country is going through the same experience, though after 50 years. And this is primarily, I was told somebody is going to speak on lifestyles. So I will not much talk about the lifestyle and all that, but this is mainly because of our changing behavior, changing lifestyles, aging and all that. So we are going through this health transition from, as you remember, when we were students, infectious diseases, malaria, TB, cholera, typhoid, gastrointestinal infections, TB, etc. They were there, and they were the major diseases we were looking at, and people were dying of. But what has happened now, these are being replaced gradually in the last 20, 30 years, and we see this trend is changing. So the chronic diseases like diabetes, cardiovascular disorders, hypertension, strokes, cancers, obesity, COPD and injuries are replacing these infectious diseases. Another transition that is taking place in addition to health transition is the demographic transition. The population of our country, as you all know, that we are the second largest and
We are shivering under the skin.
Thank you all for coming to this talk. In keeping with the theme of this conference, I have decided to talk about vaccinations in older adults. So before I start the talk, with a show of hands, I'd like to know how many in the audience routinely use vaccinations. How many of you have been vaccinated? Show of hands. Okay, let's talk about a specific infection. Let's say influenza. This year, or this season, how many of you have been vaccinated for flu? About, I would say, 30% of this group. So, just to make a point, I think the uptake of vaccinations or vaccines is generally low. I think optimistically, I could say vaccines are used in 50% crops or less around the globe. They're underutilized. In the US, the proportion is higher depending on the disease you're talking about, depending on the age group. In India, I'm sure the numbers are less. The percentage of people who get vaccinated is definitely less. And this could be due to a variety of reasons, one of which is availability of vaccines, the other one is the cost of vaccines. But I'd like to draw your attention to the vaccines that are recommended for older adults aged 65 and above, which includes all of us in this audience. Do I? Just slides? Okay. So, just to refresh our memories, vaccinations are very advantageous. They reduce the severity of disease. Even though they may not prevent infection, they will definitely reduce the severity of an infection. By reducing the severity of infections, you're also reducing the incidence of complications related to a particular infection. For example, in the case of influenza, you are reducing the incidence of pneumonia. Then next, by reducing the complications of secondary complications of a variety of infections, you are going to reduce the use of antibiotics, which will further reduce the incidence of antibiotic resistance. Lastly, we all know about herd protection by vaccinating a certain population of patients who are also reducing the non-immunized by getting infections. So I'm going to talk about the vaccinations that are recommended by ACIP, which stands for...
No controversy about flu injection, pneumococcal injection, 3 kinds of injections there. One thing we got recommendation in UK is if you had 3 tetanus injections, you don't need any more, unless there's a nasty road traffic accident. That gives you life immunity. And the other part is this shingles, we tend to be over 70 or 65. So I suppose that's not controversy, you can give to anybody.
The previous thing
Tetanus
about...
one is the main thing.
No, well, this tetanus thing is very new. It just came out recently, and this is the most recent.
Do you give it to the HIV patients?
Which one?
This zoster vaccine.
Not the live vaccine, but Shingrix you can. Actually, even the live vaccine...
Because they are the most prone people.
Yeah, but even the live vaccine, if they're not completely or very severely immunocompromised, if their T cells are over 200, we've been giving the live vaccine as well to HIV patients.
That's something new that will probably come to us next year.
Thank you, Ganesh.
Something new because
Thank you, Satish. We'll stop the questions here. I'm sorry we're short for time. Otherwise, if you wish to continue sitting, you are most welcome.
And it's immense pleasure to talk to your own friends on a scientific topic. Because the other audiences you get all over the world is different. But here you are people, there are people who listen to you with a lot of love. I know. Well, खोल यार इसका घूंघट खोल इसका क्या हुआ
बैकग्राउंड को देख के तो गाना गाने का मन कर रहा
That also adds to your mental health, to men as well. Well, I have, this talk was initially for 1 hour. Then Rakesh told me that you have to limit it to 10 minutes. So I have cut it down. I have cut it down to 10 minutes and I am going to give you...
Thank you.
I'll try to be not more than 10 minutes, but I need your full attention. Well, traditionally, older people have been respected and cared in this country. Senior most aged person enjoyed the status of the head of the family. Head of the family has had the privilege of decision making, enforcing values, judgmental position in case of conflict in the family. With disintegration of joint families and impact of the Western culture, the picture is gradually changing in India as well. We had this one who the computer has is not Devanagari friendly. So the Manusmriti Shlok does not appear here, but the translation is one who always serves the elderly people and respects elderly is blessed with 4 things: long life, wisdom, fame and power. Vidya, Buddhi, Yasho, Balam. You are as old as you feel. Our mindset in the early age, that decides what you are going to be in the old age. Throughout your life, you will be the same person inside that you are now. If you like rock music, now chances are that you will like when you are older as well. Healthy aging, healthy and active aging is a process to achieve the physical, mental and social well-being throughout one's life, particularly in the later years. Being physically healthy is important, but mental health gives value to life. If you are physically healthy, but if you are depressed, if you have Alzheimer's, if you have any other problem, then it affects tremendously, it affects your quality of life. And healthy aging is a reality, it is not a dream. I am not going into the details. Determinants of active aging are behavioral determinants: smoking, alcohol, exercise, diet, drugs, etc. I am not going to elaborate them. Environmental, moderate. Dada, this time is not the part of this presentation. Then socio-economic, personal, and the services available to the community, which is more of Shivdat's domain. Aging is a natural process, and by 2030, persons 1 in 5 will be over the age of 65. 25% will have significant psychiatric problems. Well, I'm skipping some of the slides in order to keep pace with the time, but present scenario in India are varieties of disorders which have already been talked about. We have already talked about the risk factors which are there. Shivdat has talked about them. Health problems. Then in psychological problems which you have after the age of 65 include emotional problems, suicidal tendencies, senile dementia, Alzheimer's disease, and varieties of social problems which you have, which add to the existing issues. The major mental health issues in late life include dementia, depression, and mild cognitive impairment. I don't have to elaborate what dementia is, what depression is, but mild cognitive impairment needs special attention because this is something which starts in this age. You know the person, he is right in front of you, and you are scratching your head for the name. This is mild cognitive impairment, Dinesh. It starts with time. We have to,
I remember.
you remember it well. But you did mention to me, what do I do for it?
इसलिए ये मत कहो कि दोस्त के घर नहीं आएंगे, दोस्त के घर अक्सर जाओ, ये सुदामा का घर है, गाना तुम आते जाओ. Thank you.
All questions will be on a one-to-one basis with Gautam. Otherwise, it's likely to stretch like a chewing gum. May I now request the next speaker, Dr. Ravi Kapoor, to be talking on the spiritual aspects of aging.
Right, and I'm going to talk extempore. I made some notes with the help of my wife, of course, and I'll be just, the topic is so interesting, that aging gracefully. And before we start, let me do some small prayer. Astoma Sadgamya, Tamsoma Jyoti Gamya, Mrityuma Abhritgamya, Om Shanti Shanti Shanti. The meaning is from untruth to true, which is God. From darkness to light, which is knowledge. And from Mrityu to mortality, from mortality to immortality, and then also peace, peace, peace. Now let's start. Now, the aging gracefully, when we are aging, our health, or physical health, exercise, they are all important. But at the same time, our emotional health, psychological health, and for that I think we need spirituality. And every one of us, from cavemen to today, and all of us want to know if there is the God. If there is a God, and who are we? What's our purpose in this life? And that answers everybody wants to know. So the God, when we see around that there are so many good things, plurality, the cosmos, the beauty, and also the beauty with the, are symmetrical. How would you feel one arm strong, longer than the other arm, and eyes are here? All those symmetry and beauty, these are the effect we see. if the fact we see, there must be a cause. And the cause in philosophy we call it ultimate reality, and religion we call it God. And when I got retired about a few years ago, and I felt like I just had some time and wanted to know about religion, because I grew up in the Hindu religion, where in Hindu religion, while in Abrahamic religion, there is one God. In the Abrahamic religion, there is one God, one book, and one way, and one prophet. In Christianity, it's Jesus Christ, and there's the Bible. But and also in Islamic religion and in Judaism, there's one God, one book, and one prophet. But in Hinduism, there are many gods, and there are many books, and there is no prophet. So, while in Hinduism there are many books, and the books are those scriptures, and there is no prophet, and also there is so anyway, when I got confused with this, whether with the Abrahamic religion as well as the Hindu religion, I was attending a seminar done by Chinmaya Mission, and Swami Tejomayananji was there, and I heard something about Bhagavad Gita. I got interested in Bhagavad Gita at the time, and also came to know. I bought a book of Bhagavad Gita and started reading here and there, like all of us, we do it. One time I was watching TV and I saw an interview of Mr. Robert Oppenheimer. I don't know whether you know Robert Oppenheimer, but Robert Oppenheimer is the one who made the first atom bomb. And he said, when the experiment was done in New Mexico desert, the mushroom cloud came with a lot of light, and at that time, few people were crying, few people were laughing, and he said, a few people were stunned. He spoke the verses of Bhagavad Gita at that.
Friends, let me start by telling you two true life stories. One of my colleagues who married a girl who was very qualified. This was an arranged marriage. She had a beautiful voice and an even more beautiful face. And they were both making money, she as a radio announcer and my friend as a clinician. One fine morning he decided that he had to go to Saudi Arabia. I told him, why do you want to go? You are making enough money here. I told his wife, why do you want to go? She said, I don't want to go and I am not going. If he goes alone. So this guy, he went to Saudi Arabia, stayed there for 3 years, made a lot of money, sent all his money back home. And when he came back, he found that his wife had withdrawn all the money from his account, had sold the house which he owned in that place, and had decamped with his son, didn't know where. This is a true life story. And this was an arranged marriage. Second story. Another colleague of mine married to a medical college colleague of his. They had a love affair, they had a love marriage. She was a gynecologist, he was a clinician. Again, he decided that he wanted to go to Saudi Arabia to make money. Where is she? Riches. Riches. Well, because she was a gynecologist, she got a contract first. She went, and about a year later, he followed her. After about a year or so, it was discovered that he was having an affair with somebody else in Saudi Arabia. And because in Saudi Arabia, adultery is a vicious crime where they stone you to death, he came back with his lover girl to India, leaving all his money behind, just with his passports with him. Again, love marriage. So what is the moral of these two stories?
Don't marry.
I wouldn't say that, Geeta. That would be a little atrocious. But I think the moral of the story is that whether it is an arranged marriage or it is a love marriage, whether it is a new marriage or it is an old marriage, marriage requires an input. There has to be an input in marriage. It cannot be static. The second moral of the story which I made out was sort of what Geeta said: do not live separate lives in your married life. If you have to make a compromise, stay together. The moment you separate, there are every chances that you will separate forever. And if you are still together after a life of separation, then you are one of the lucky ones, the exceptions which prove the rule. Now, how to help someone achieve balance in their personal and working lives, which is important for your marriage. This is what I would like every one of you to define. What are your current roles in your life as a whole? How do you look at your life? Second, what is your responsibilities now? You are retired. But even as a retired person, you have responsibilities. And what are those responsibilities in your perspective? What are you accountable for in your life and to whom? Apart from your wife. Who else are you accountable to? What do you spend your time doing? And what do you call yourself as you are doing these times? For instance, my wife calls me a couch potato when I watch the TV. So what does your wife call you when you are doing whatever you are doing? Now, Anita Horton, she is a writer for the British into 8 quadrants. Your life as a profession, your partner and love, your self-care, your health management. Now, this is a question which I am posing to all of you. Imagine yourself in this 8 quadrants of your life. How much of each do you actually?
Good morning, all my friends from different part of the country, abroad and everywhere. Once again, I welcome everybody in this scientific session. We are not much dealing with a lot of technical things, but we just sharing our views about different. We have listened from so many experts about the aging from the male side. Now I'm discussing with the female. As you all know, aging gracefully is often used the word like udarta or emphasizing. It is just a, and people may use the phrase to mean looking old, but embedding it showing the sign of aging, but still powering forward of the life. We should not think too much about the how do we age nicely. Aging has been the fact of the life even since it was created. Human beings go through the various phases of the life, from being child to youth, to become adult, and to become old gracefully. Aging has been believed to be inherited, universal, progressive, and natural phenomena. Everybody is agreed to this. Right?
आज फिर मरने का इरादा
I must think everybody has seen this movie. What are the major changes in the female during the reproductive organs? What are the hormone change in the female with the age? What are the reproductive change in the with the menopause? And what are the some? Because we are just technical things we are just share with the male partner, because female most of them they are knowing. So we all know about the female reproductive organs. The changes occur during the aging is most important. The hormonal changes. Cells in the hypothalamus secrete the gonadotropin hormone in both the male and female, and which reaches through the portal systems in the anterior pituitary, that is a very important organ, and secrete the female hormone FSH and ALH. FSH is stimulate the estrogen, that is the female hormones, estrogens, and luteinizing hormones stimulate the release of the ovum from the oviduct and produce the estrogen and progesterone. So the estrogen and progesterone only secrete in the female, that everybody should be know. So what are the changes going in our body and what to do? So there are the changes in the female hormones with the age and affect the female reproductive organs and other organs also. These are the important hormones, and the estrogen level early in the cycle of the menopause stage, decline in the menopause, and slowly this hormone is decreasing as the age is advancing and there is a estrogen deficiency in the menopause age. So a lot of the changes in the female as the age advances, it is due to the decline of the estrogen hormones, and the hormone replacement therapy during the menopause is the one of the things which is giving during the time of the aging, as the woman is showing the lot of the changes with the menopause. This is the normal cycle is occur in the female with the gonadotropin hormones. So it is directly hypothalamus pituitary ovarian axis which control the normal menstrual cycle, because most of the spouses are sitting here are the female and they are not the doctors, which are the partner of our the doctors. So we should know what changes are going in our body, and this is the normal physiological changes occur in our body. So the most important things which I want to discuss is as the age advances, now what problem we are facing due to the career, due to the age advances. The most important problem which we gynecologists are facing are the fertility, because the cycle will be annually continuously after the menopause as the age advances. After the 35 years, the peak fertility is at the age of 24 years, with a gradual decline after the 35 years and rapid decline after the 45 years. So as the age advances, the fertility is decreasing. So this is the important side, just I want to share with you. Decline the follicle. The 2 million primary follicles are during the fetal development. Decline to 1 million at the birth and 2050 by the puberty. In the absence of both hormones, these follicles become atresia, and once follicle will be atresia, there is no hormone production, and that is the big problem as the age advances. So what to do if any couple wants the baby after the age 35, 45, or this is now the most important things is going all over the world. What to do? What is so? In vitro fertilization. What is the in vitro fertilization? Is the age advancing? Should the couple should be pregnant, or they will go for the pregnancy, or they have the baby after, or the single? Because most of the doctors are sitting here from the abroad. The single parents are the one, but in our country still not this. So in vitro fertilization, this question is asked in my RPC examination. What is the name of the first baby born by the in vitro fertilization? In 1977, the first IVF baby, in vitro fertilized baby, the name is Louis Brown. But this is the birth of the first baby at the in vitro fertilization. And in India, after the 9 months, the baby first born in India, the name is Durga, who was born 67 days. The first IVF baby in our country, and her name was the Durga. And what is the indication of in vitro fertilization? Because as the age, ovulatory dysfunction. Why there is ovulatory dysfunction? Because as the age is advances, the ova become the mature. So So if we are not aged by the physical or anything, but ova is definitely mature after the 35 or 45 years, that is the aging of the ova. One should be always keep it in mind, because that is a very important indication for in vitro fertilization. Age-related infertility. Male partner is also very important factor for the in vitro fertilization, and the genetic factors. So these are the normal procedure is going on. I am not saying any detail about these things because we have already short of the time. Ova is collected from the oviduct and the sperm is collected outside, and there is a formation of the embryo, and there is the intracytoplasmic sperm injection in the ova, and there is a formation of the ova. This is just general knowledge. Embryo is transferred in the male, and one is important now. The question is moved further ahead. That is the surrogacy mothers. So that is the now the actors they don't know. Shah Rukh Khan has also had the third baby by the surrogate mothers. A lot of the question in India in spite of this all the things. So this is the one of the important issues about the surrogacy mother. Whether anything and a lot of the problem, because most of the foreigners are coming here for the surrogacy in India, and now it is by the government of India it is banned that nobody is going for the surrogacy from the foreign or other things. So what is the surrogacy about? They select the surrogate mothers, consent, lot of the legal problems associated with the surrogacy. And one should be very, very important things is about, we know it is a very important things. If in both the couples of the absence of the uterus or any other problems, genuine problem, they can go for the surrogacy.
Veena, may I ask you to wind up, please?
Okay, wonderful. The doctor already told me about that there is no time. I don't have any problems regarding all the things. We have a lot of things. Dr. Mathur will be, Dr. Dinesh will tell about the collagens, remodeling about the skins, and other problem now. The another things is now in the vaginal regeneration, because that is also important things which is going on the day-to-day practice. And the management of the graceful about the menopause is by the in the morning we have heard about the all the how to go for the yoga, benefits of the exercise, fall prevention, improvement. The yoga master have already told about things, and regarding the exercise, he has mentioned about the food, what type of the food we have to take in the menopause as the age advances. This is also very important. Regarding the brain exercise, mental health, Dr. Ravi and Dr. Shiv Gautam has already discussed about all the things, and that all are the very important things in our day-to-day practice. नहीं बताना चाहती हूँ, जब भी ये सवाल कोई पूछता है मैं सोच में पड़ जाती हूँ। बात ये नहीं कि मैं उम्र बताना नहीं चाहती हूँ, बात ये है कि मैं हर उम्र के पड़ाव में फिर से जीना चाहती हूँ, इसीलिए जवाब नहीं दे पाती हूँ। मेरे हिसाब से तो उम्र बस एक संख्या है। थैंक यू सो मच।
वो आजकल तो आधार कार्ड में, पैन कार्ड में सबके अंदर उम्र ऐसी लिखी हुई, इसकी शक्ल ऐसी भी आती बिल्कुल जो है, साला खुद भी नहीं पहचान सकता आदमी। इतना बुरा होता नहीं जितना आधार कार्ड में दिखता है। 5 मिनट मैं तो ये आपको तो मैं हटा देता हूँ, लेकिन क्या वो स्लाइडें लगा रखी है ना? नहीं दामद तेरे को तो बताना ही पड़ेगा।
2 साल जिला तेरे को
bear me for next 5 to 7 minutes. I'll just rush up the slides में I tried to उनको वहाँ पे मैंने हटाने की कोशिश करी, वो हुआ नहीं, लेकिन फिर मैं कि चलो all right. So I thought that I'll burst the bubble of pampering the aging skin. So do not regret growing older. It is a privilege denied to many of us here tonight. And the trick to aging gracefully is to enjoy it, and that is what we are doing it last one day, and we will be doing this evening also. Well, just to rush up the slides, that what exactly is aging, which is a process both intrinsic and extrinsic, and which happens because of the constant effect of gravity of soft tissues and final results of sagging over the facial skull. Causes of aging and all the intricacies has been discussed by Dr. R.C. Gupta, the telomere and all these things. So I'll not go in that detail, but there are at least 2 types of aging: intrinsic aging and extrinsic aging. And these are the finer details which I'll not go through it. It's not a, but wrinkling is very important and we all, do you want to? मेरे को लगा मेरे को सब करे थे 5 मिनट हाँ मतलब इसीलिए मैं राकेश जी कह रहे थे मेरे को पहले आने थे पहले लोगों के इंटरेस्ट की बात बताऊँ मैं मान ही नहीं रहा था इसको आज शाम को खत्म all right so mild wrinkling starts from almost 25 to 28 years and there are few wrinkles of no keratosis. Moderate wrinkling 35 to 50 years. Early wrinkling, shallow complexion with early actinic keratosis and advanced that is in 50 to 60 years. 50 this persistent wrinkling. And जो अपनी एज के अंदर है उसमें severe wrinkling हो जाती है कई बार photo aging हो जाती है actinic keratosis without skin cancers ये सारे के सारे हो जाते हैं. But for that you should have good spirit in the mind also and good spirit in the hands also in the evening. Well, against Dr. Shiv Gautam's advice and all these things, but alcohol is definitely excess is bad, but moderate alcohol is good. And that researchers has proved. So just rushing up a few anti-aging therapies, cosmetological care, topical agents, systemic agents, and procedures. So I'll just नहीं लेकिन वो अभी फिर वो करेंगे ना well this is the prevention of dry skin. Keep your humidified environment, good fluid intake along with many additives in that, no hot water bath or shower, moisturizing the skin daily and minimal preservatives and no fragrances. We as a dermatologist we do not advise fragrances. Hot water bath that causes dryness, but of course you can have lukewarm water, but not very severely hot. Lukewarm. Senile purpurar atrophy is very common. Common skin tumors in elderly. I'll not go and I'll not teach you over here. Pearls to prevent xerosis and aging. That is, environmental factors promoting xerosis include cold temperatures, which many of our friends they are coming from there, and low humidity and excess water or washing. Soap selection should be good and harsh and heavily fragrant soaps should be avoided. And put a cream or moisturize it at least 2 to 3 times a day. Or oil or moisturizer is very important. First, to prevent the xerosis in aging is sun protection, avoid sun exposure. Wear a sunscreen lotion as much as possible you can wear it. Avoid oxidative stresses like smoking, alcohol, more of alcohol, not less. lack of sleep and diet.
एल्कोहल के बारे में दोनों बार के लिए अवॉइड भी करो और थोड़ा बहुत
नहीं वो तो पढ़ाते टाइम तो बोलना पड़ता है बट अदरवाइज तो वो कई सारे राजे महाराज में वो ये है ना ये क्या नाम से बाबा लोग जो है ना वो प्रवचन दे करके अंदर हो गए. Then antioxidants like vitamin C, resveratrol. Resveratrol is probably the proved anti-aging agent, and most of my friends, those who know it, resveratrol is an anti-aging agent which works on this telomeres and DNA and all these things. And probably I am in the habit of prescribing resveratrol and as well as taking resveratrol also. Yes, it is available here. Resveratrol is available. Resveratrol is available. And it is a proved anti-aging which Gava you can even read out in the Harrison. Yes. Oh yes, there is no harm in taking the antioxidants and resveratrol. Lycopene, beta-carotenes, vitamin E, flavonoids. Avoid high glycemic foods. And do you know which is the lowest glycemic food? Lowest glycemic. Mufli jo apne shaam ke time pe lete hain. Mufli has got the lowest glycemic index. Signs of facial aging. Bagging under the eyes, wrinkling around the eyelids called as crow's feet, cheeks and mid-face, malar face, jawline, neck, and this you can see that these are the changes in the bone and fat pads due to aging. Can you appreciate?
Yes.
All right.
Day in and day out we are appreciating.
So these are the changes in bones and fat pads due to aging. And if you see a youthful look depends on having the right amount of facial fat and at right places. Redistribution, accumulation and atrophy of fat leads to facial volume loss. और जहाँ पे जैसे लटकने लग जाता है वहीं पे जो है सत्यानाश हो जाता है. Some areas loses fat, forehead and cheeks. Other areas gain fat, mouth and jaw. And modification of the fat pads leads to contour deficiencies. And these contour deficiencies, as somebody was telling, that that is the beauty outside. So how does the wrinkles form? किसमें wrinkles का तो इलाज भी करने के लिए areas of face that ages most, crow's feet, worry lines, and these angle of mouth and these drooping cheeks, which most of us we suffer from that. And these are the aesthetic treatments in dermatology. I am not going to discuss much of them. Aesthetic treatments let me put some of these keratinoids, Cerasus capsules. They have been termed as anti-aging capsules, which we do not have probably, particularly for you in the US or UK. You must be having these Cerasus capsules. Dietary flavonoids and phenolics, omega-3 polyunsaturated fatty acids, and efficacy of oral sunscreens probably has not been much discussed and not it has been not tried. And topical sunscreens, we all know topical sunscreens. In India, we do not require more than 30-35 SPF sunscreen. Whereas probably in the US or UK, you may be requiring higher these sunscreens. Tretinoin is a proved anti-aging topical therapy. And tretinoin in lesser concentration is a proved anti-aging therapy. For if you apply them for months together, probably definitely gives you an anti-wrinkling phenomenon. Tretinoin and tazarotene are FDA-approved anti-aging agents. Resveratrol is an FDA-approved anti-aging agent. And start with mild form. This I'm not going to in details. Vitamin C is an antioxidant which has been proved in anti-aging. Well, other anti-aging topicals are this is a very tongue twister. Plant cytokines, antioxidant properties, chlorella. आजकल एक तो ये इतने ज़्यादा जो है ये आ गए हैं all these cosmeceuticals and nutraceuticals deriving from these herbs and shrubs. Copper peptide complex is another this thing which is nowadays many times used. These vitamin C, vitamin E, glutathione. Glutathione is nowadays is being a lot of use throughout the world. Selenium, zinc, coenzyme Q, melatonin, and green tea polyphenols. But green tea, well, these are the procedures, office-based treatment. Microdermabrasion we do regularly and routinely for anti-aging therapies. I'm not going to tell you. Chemical peels is a very common procedure which we dermatologists do, and which is very common. And most of these beauty clinics and they all promote these chemical peelings, and that gives an instant glow peel and instant bridal peel and all those kinds of peels which we have started working on that. Botulinum toxin is a very, very interesting thing, and botulinum toxin that reduces wrinkles and is very common. Lasers. These are cutaneous resurfacing is being done by ablative, non-ablative and ablative carbon dioxide lasers. Non-ablative radio frequency lasers, they are also very, very, very effective in causing the lessening of the wrinkles and tightening of the face. Well, intense pulse light laser is also very common, which has got many filters, and intense pulse light lasers we use every day for using this anti-aging therapy. Fine. These are dermal fillers which can immediately give you these less of wrinkles. They cost around 13 to 15,000 rupees an injection over here, which we can give at least 2 injections, one on this side and one on another side, which is very common in these. Lip augmentation is also very common nowadays in the girls and the female, which we give with the fillers
Dinesh, in spite of public demand, your time is out.
All right, fine. Then listen, thread lift, because sometime you may come with me for the thread lift. So do not regret growing older. Once again, I remind you, it's a privilege denied to many of us.
I now invite Dr.
Good
Geeta.
thing for last.
Hi, welcome. Let's welcome them.
Right.
Welcome all.
This afternoon we have kept a
Biologic therapies in asthma, which is something I don't know how often it is used in this country. Even in the United States, it has been recent approval of certain drugs that are only indicated for severe asthma, which, as you know, is only about 5% of the total asthmatics. So it's a fairly rare problem, but the problem is very important because it causes increased mortality. So I was initially asked to talk on this for about 20 minutes, and then yesterday we were told 10 minutes. So I'm going to kind of rush through the slides and kind of give you just the names of the drugs that we use and some of them that I have experience in using. So what is the need? Why do we need the biologics? Patients with severe asthma who are uncontrolled despite elimination of modifiable factors. Modifiable factors include non-compliance and correct use of standard therapy, using of inhalers with spacers, without spacers, and correct doses, etc. Severe poorly controlled asthmatics are at increased risk for asthma exacerbations, medical interventions including hospitalization, and it causes reduced quality of care. So I was thinking, how is this topic related to aging gracefully? Asthma is one of the factors that contributes to chronic diseases, chronic, non-communicable diseases, and COPD, persistent asthma leads to COPD that causes mortality, and it's actually fairly common disease, as you all know, and throughout the world it's prevalent. 5% of the people with asthma are considered severe persistent asthma, and it accounts for 50% of the economic cost of asthma, because they go to the emergency room, they go to the hospital, they get admitted and readmitted numerous times, and then they have to be treated with parenteral treatments, etc. And the factors could be persistent asthma, persistent severe asthma. And again, that is the reason we need to pay attention. And when I started my residency, we started with just bronchodilators, and now we've come to the biologics. From bronchodilators to biologics has been the advancement of treatment of asthma. So it's a complex disease, and it is characterized by inflammation and airway abnormalities. Multiple phenotypes and underlying biology are recognized. Now, initially, when I first started, my training in the United States in 1977, we knew asthma as just, a tree where you have, we didn't even know much about inflammation. There was just bronchoconstriction, and we used to treat them with bronchodilators, and then gradually, we went on to the mechanism of asthma, physiology of asthma, inflammation being a major, aspect, and then now we know how the inflammation happens. So multiple phenotypes of asthma and underlying biology are recognized. Broadly, asthma can be separated in two categories.
Yes, I can just tell you this much, that my interest in allergies came from the SMS Medical College. You know how I used to go to the library very regularly, and I used to read history of medicine. And you will be surprised to know that our first principal, or I don't know whether he was principal in our time or not, but Dr. R.M. Kasliwal, who was the physician of Subhash Chandra Bose, Netaji Subhash Chandra Bose. He was a great aerobiologist. And those days, there were no instruments to study aerobiology, but he used to put glue tapes on the kite, and he used to fly kites on different atmospheric strata, and he used to capture pollens and fungal spores, etc. from different strata, and that is the first published record of aerobiological studies from India. And I really used to wonder that such an interesting activity can also result into, scientific this thing. So when I went to PGI Chandigarh, I got interested in, studying immunology. But I took admission in MD Pediatrics, and there was an opportunity to do, thesis. So I did thesis on vitamin A deficiency and its immune responses. So it was some way related to immunology. But my quest was, still unfulfilled. So after doing MD Pediatrics, when I was living in Chandigarh, I just saw that April, May is the exam time, and April, May is a very, very busy time for farmers, for harvesting. But we used to have number of asthmatics landing up into emergency. So we thought that, my God, some children are getting school dropouts, and farmers, instead of, earning their livelihood, they are getting admitted in the hospital and losing on their livelihood. So we need to do something. So there was a very nice lady, she's again from our college, and she was in the PGI pediatrics department at that time, and she had done allergy immunology from Denver, Colorado. She's daughter of, Dr. Bhatnagar, the one who was our forensic medicine professor or something. Her maiden name was Lata Bhatnagar. So she used to practice allergy immunology, and that was the first allergy clinic in India in the PGI. Of course, in SMS, Dr. Baldeva used to do, but then she was the qualified allergist. So she became my mentor, and she told me that, okay, if you are so keen in this, why don't you start doing something? But unfortunately, there was no DM in allergy immunology. So people used to just think that after doing MBBS, if you do DM, this is 2 years of study, and you become a cardiologist, you become a gastroenterologist, you become a neonatologist. So I had also taken admission in DM neonatology in PGI itself. But after 5 months of doing DM neonatology, there came an opportunity that we could do PhD in allergy immunology. So I, with her help, decided to study the allergens connected with the April-May respiratory allergy, and worked for 5 years on this particular subject, because we were just relating this data of ours with the wheat threshing season, pre-season, post-season, and also the season, and then we were trying to correlate it with the meteorological data also. So 3 years of study, the meteorology was inconsistent. 1 year there was rain, second year there was no rain.
Outside of the particular allergic situation, individuals also. We have seen allergies with the sight of an individual, the individual is getting rashes. These are basically psychoimmunology processes.
So friends, that's it now. I had brought the slides, but सबको मैं बोर नहीं करना चाहती और ज़्यादा बोलना भी नहीं. But this is enough. And also one more important message I want to give, and that is, in allergy test, what is being done nowadays is that there is so much commercialization. People would just take a blood sample and send it somewhere and get the whole list of allergens. This is absolutely wrong. It is so confusing. In allergy diagnosis, what is most important is a detailed history by someone who is qualified and aware of what to find. So we should take all the detailed history, that what triggers, even environmental factors like people living indoors most of the times. Our children are always indoor. They are either in the classroom or in the tuition room or in the house. And suppose if the house also has fungus all over the walls, then out of 8 hours of sleep, all the 8 hours they are inhaling fungus. So we need to take the history in detail. The allergy testing has very limited role. We have to absolutely be sure what we want to test. And that can come only from the detailed history. It's not that every allergen has to be tested. And skin test is the gold standard. If you are suspecting food, then double-blind food control challenge tests. They should be done. So we should be absolutely systematic rather than just giving confusing list, and we should avoid remote allergy testing. That someone who has not seen the baby is just assaying a blood unnecessarily. So that is also my important message. Thank you.
May I now request Usha Acharya? Are you there? She's not feeling too well, so she'll be talking on care of grandchildren.
Not talk much about this. In fact, I'm a pediatrician. I never thought that I am going to speak anything on the graceful aging. But my friends ask me, Usha, तुम्हें पता नहीं है?
Give us 5 tips.
Oh, no 5 tips, not a single tip. Usha, you don't know कि grandparents को कितनी problem होती है. Being their doctor or daughter-in-law, and everyone asks, तुम्हें ये नहीं पता, माँ ये बताओ, वो बताओ. So I thought I prepared some slides, and slides basically for non-medicos grandparents. But time is over. Any problem you have got, you can ask me at any time, any moment on lunch time. Okay, goodbye.
Best speaker award.
You have listened so many scientific talk, so I should limit myself.
You can run through the slides quickly.
कोई ऐसी स्लाइड भी बहुत स्पेसिफिक नहीं है.
Okay, whatever it is.
आपने मेहनत करके बताइए।
जब हम प्रिंस को जेल सकते हैं विद्यालय के जेल डर गए
ये लोग बहुत समझदार हैं. इन्होंने मेरा how to keep the temperature, ये सबसे how to take care of umbilical cord, bath time, how the bath is to be given. This is for especially for a non-medicos mother. Massaging babies, changing into diapers. Just go to the slide. I'm not going to talk anymore.
Go ahead and go slow.
No. There is no time. It is already 1:30. Anyone, they can come forward and ask. No, the running is good. Shall I tell you the steps of breastfeeding? That is very important, and most of the time mothers are coming with a cracked nipple, and the cracked nipple is a basic problem of faulty techniques of breastfeeding. All the gynecologists and obstetricians should know how to feed the baby. The best way is the baby's mouth should be open, areola should be in the mouth, lower lip everted, and tongue should be behind under the teeth. And basically on sucking the areola there will be the lactation, not with the nipple. If they will suck on the nipple, there will be failure of lactation, and the problem will start. And माँ मेरे तो दूध नहीं आता क्यों पिलाऊं? And it's very easy to feed with the feeders. We never advise for feeders, and this is the wrong technique. You can see the photograph. No need of comparing cow milk and human milk. Everyone knows human milk is the best, and what are the advantages you read in the book and see in the net. Crying baby is another problem. Baby usually cry for more than 2 hours in a 24 hours, and besides the colics, commonly we say there is an evening colic or afternoon colic. Sometimes they cry in the night also, and that becomes the emergency. But it should not be there. One should look for physiological causes of crying. That may be wet diapers, or there may be pin pricking, or tight clothing, so too much of the clothing, too less clothing, and quarrel between the parents. No sound environment. That is the biggest cause, and sometimes we just forget to check it. What is the problem? If the baby has got colic, clinically we can judge as a grandmother. You just see that, keep the baby on the shoulder or in a prone position. He will pass the flatus and he'll burp, and automatically he will be better. Does not require any specific treatment until unless it is a long and persistent cry. complementary feeding, it should be started by the age of 6 months in India, and abroad it is 4 to 5 months. Always start with the semi-solid, with the spoon feeding. The importance of the spoon feeding is with the touch of the spoon there will be stimulation and child will learn using his lips, jaw and all this. So the later on the feeding with the khana khilana easy ho jayega usko. So start with the feed with a spoon and katori chammach. Semi-solid in a paste form, easy to digest, easy to take in. Start with a small, this is basic fundamental is always when you start supplementary feed, you start with the one item, not all the item together, in a small quantity and gradually increase the amount. And subsequently by about the age of 1 year, it should be 3 to 4 times in a day semi-solid and 2 to 3 times of the milk, and 500 calories from the semi-solid and the rest with the milk. Accident, we should avoid the accident, and I have come across the one accident. I'll tell you, the parents were doctors, both were working, and it is in the Char Diwari of Jaipur somewhere, in Purani Basti somewhere. The doctors were practicing and the child, he was about 1 year old, walk karke, washroom khula tha, chale gaya, and he put his head in the commode and he died on the spot. They brought the dead babies, we were unable to save that child. So these are the sometimes very small things. We should take care of all this. There are so many types of accidents, we should take protection of them. I am not going to tell you details. Common stomach problem, this is very common in school going children. This is 80% it is functional, 20% it is organic, and functional may be attention seeking, does not want to drink milk, or examine the school, or fight with the friend, or apprehension, and so many things. We should first take the detailed history and try to find out. Second is a headache. School se bachcha jab aata hai, headache hota hai, to mostly it is a visual disorder. Otherwise, if the child is complaining of headache at any time, and you ask them, "Tumhe khelne jana hai?" Yes, there is no headache. So headache they learn from their elders. So by the history and all this, we can find out the cause, and visual error should be taken care seriously because this is a very common problem for the headache. Obesity, it is a major problem in developed and developing countries, and this is because all you know, habit disorder. That's all.
Thank you, sir. Thank you. Now I request Dr. Venkat to please come and talk about arthritis and aging.
Good afternoon, everyone. I don't want to take too much of your time, stand between you and the lunch. First of all, I want to thank the organizers of this function for doing a fantastic job. And I think it's a great reunion that all of you are having, renewing old friendships, rekindling old memories. Very fortunate that you are able to do that. And lastly, I'm very touched and overwhelmed by the generosity of the organizing committee to give me a chance to talk, even though I'm not part of your alumni. I thought, for a time, introduce you to the subject of osteoporosis. All of you in primary care, orthopedics, obstetrics, gynecology are aware of this topic. It is considered a very silent disease. A silent epidemic is taking place around the world. It is a mammoth public health challenge. And if you look at fractures as a whole, more fractures occur than all the other chronic diseases one of the speakers alluded to. And the shifting management paradigms that we are now witnessing in the diagnosis, prevention, and treatment or management of osteoporosis. The important thing to understand here is the definition of osteoporosis. The National Institutes of Health in Bethesda, Maryland has a consistent consensus development conference in March 2000, which defined this disease. And as a disease characterized by compromised bone strength, an increased risk of fracture. You can see here the cartoon, how the bone becomes fragile. It's almost like an analogy to a pillar being built with cement and concrete, and you see the matrix becoming very thin, and this is part of the trabecular bone, which is the most important part of bone which fractures in osteoporosis, and you can see the cartoon on the left showing how brittle it happens, which leads to fracture, and so it basically bone mass becomes low, and there's micro-architectural deterioration, which leads to fractures. Now, I thought during this talk that instead of bringing a lot of Western literature, talk about osteoporosis in India. Most of you already probably know a lot more about this than I do. But 26 million Indians suffer from osteoporosis, is expected to reach 36 million by 2030, and probably even more. And the estimated number of hip fractures projected for 2020 and 2050 is just incremental and alarming.
Naturopathically, what we can do in our day-to-day life. Drinking some of the natural things and every day in the morning will make you, give you a lot of antioxidants, which will, and you can use it every day in your home. Juices of the wheatgrass, another juice of the aloe vera, giloy, basils, and turmeric and amla. If you take the juice every day, it is a lot of the benefits. It has been written in the lot of journals. Second thing is the pranayam. 4 parts of the pranayam is an excellent. 4 particularly I mentioned is a lot of the process for the pranayam. But for the Bhastrika, Anulom Vilom, Kapalbhati, Brahmri, or Uddit. These are the pranayams, mainly this Kapalbhati, Anulom Vilom, Brahmri and Uddit. These 4 are very important and gives it a mental state. First thing I want to let you know, the aging is nothing but a mental thinking of your own. Isn't aging is a number and nothing like it. Why you can control your mind by yoga. Yoga means adding 2 things. That is the soul, your body. And the controlling your body is the most important thing. And you can achieve it by doing the pranayams. I tell about myself, I used to go for the MRI. I was not able to control my mind. Claustrophobia was there, but I used to come out of it. After doing a lot of pranayams, and I think it was comfortable for me to control mind and going for all these things. So I would like to mention few of the, although I am not prepared completely, but anyway I wanted to speak. Mainly, in the pranayam, this Bhastrika pranayam, Bhastrika is the name. Taken you see the Luharo ke jo chalta hai, that is the talking. That is a Bhastrika name taken from the, you're breathing like that. So taking inside fluid and throwing it outside. Kapalbhati, they studied the morning you attended to yoga. The Kapal means breathe and Bhati with the abdomen you control the brain. Is the typical reverse of the what normal breathing we are taking. Normally breathing, passive exercise is an exhalation and inhalation is the active. While in the Kapalbhati, exhalation is the passive, active, inhalation is the passive. So we just control the lot of the benefits are there, improve your immunity, lot of the things are there. It all helps in going for the good aging process. So details cannot be given for this. Time isn't perfectly. Just I will take another 2 minutes. You have taken 2 minutes.
Minimum duration of this.
Minimum, at least you take for these 15 minutes should be at least for Kapalbhati and Anulom Vilom. Gradually increase from 5 minutes to 15 minutes, there will be a lot of the benefits. More thing, a lot of things are spoken, but I tell you something about in a very confusing state among ourselves. I'll take 2 minutes, little bit going ahead of the topic. Other side, The acupuncture and acupressure is misnormed and they confuse normally. Just you consider, I'll just explain in a layman language what the acupuncture is and how does it work. What is the difference between a live person and a dead person? What is missing out of that? Is your, what you call is a prana vayu or the life energy is missing. From where we got it? Is it available in the world? No. We get it from the mother's womb. There's the genetic energy we get from the mother's womb, which keeps on growing until your youth, and it keeps on declining and it becomes a zero. That is the death point of this. And acquired energy we take day to day from sun. Sun is the main source of energy for all the things, and indirectly we take it from it. The main we take it from the sun, and it is being absorbed by the different chakras, 9 chakras and 9 rays of the sun. It is being at particular organs are being controlled by that. The energy is never singular, it is in a pair. Same way, each and every cell of the body is connected with the energy. And it is in pair. What you call it, you can call it is a negative, positive, and in Chinese you know yin and yang. So whenever there is an imbalance of these energies, there is a...
मैं एक छोटा सा दृष्टांत आपको बताऊंगा जो आपने रामलीला में या रामायण में पढ़ा होगा, वो नहीं, उससे आगे बताऊंगा। आपने वो दृष्टांत सुना होगा कि जब सीता का हरण करके रावण ले जाता है और गिद्धराज रावण से बड़ा युद्ध करता है, लेकिन रावण से मुकाबला नहीं कर पाता है। उसमें इतनी शक्ति रहती है कि राम को आंखों देखा हाल होता है। जब राम लौट के आते हैं तो वो अपनी सारी व्यथा कैसे कैसे सीता को ले गया बताया। वो पंख विहीन जटायु जब श्री राम के गोद में आता है तो लोगों ने राम से प्रश्न किया कि उसकी ऐसी दशा देख के आपके 2 बूंद आंसू भी नहीं आए? तो राम का जवाब सुनना। राम ने कहा, आंसू बहाना बड़ी बात नहीं है, आंसुओं को रोकना बड़ी बात है। और ये आंसू अगले जन्म में जब द्वापर में ये जटायु होता है, सुदामा का अवतार लेता है, तो सुदामा का उन्होंने ब्याज सहित चुकाया था और सुदामा के चरण पखारे थे। दूसरा कारण ये भी बताया कि उसके पंख विहीन जो शरीर था, मांस का लोथड़ा, यदि आंसू की 2 बूंद भी बहाता तो उसके नंगे शरीर के ऊपर जलन हो जाती। एक दृष्टांत शेयर करना चाहता था। धन्यवाद।
Yes, good evening, good afternoon, ready for lunch. We don't want to be between lunch and you. So basically, very high caliber speakers and very patient listeners. 14 speakers in such a short time. Dr. Gupta gave us very good review of DNA, telomere shortage, unless until we find a tablet for Dr. Gupta talked about non-communicable disease, basically very important, that depression is going to be very important, and Dr. Watt, of course, we need to have Syndex for the patients and ourselves, pneumococcal vaccine for ourselves and patients, very important, especially immunosuppressed, and of course, tetanus, Vidya Buddhi Yaso Valam, and attitude, that's the key. Dr. Kapoor gave us very good spiritual healing and aging, especially he gave us Gita Sar. We should read a little bit of Gita.
What do you want to say? Aging gracefully by taking those drugs which I am taking, the herbs. I am taking balm, ginger, turmeric, haldi we call, aloe vera of course, amla, gooseberry is there. I take ashwagandha. Ashwagandha is for joint pains also. Ashwagandha. I take the mixture is there. I take wheat grass, giloy, and there's one more with honey. Honey is antibiotic. So we take antibiotic every day. I take honey every day. My consumption is about 4 kilos of honey per year. When I like all my friends to know all these things, I will ask the person to give us samples so they can take it to their respective places. And honey, I tell you, diabetics are afraid of honey. But honey, when it goes in our mouth, the saliva is there, enzymes are there, it changes into sucrose and fructose. So honey is not dangerous for diabetics. I prescribe honey to all my diabetics. Secondly, what I prescribe to my obese people or conscious people to have fruits and roughage in one meal. Like you have your rice, chapati, dal, sabji, all this. But try to avoid one time, that is, say in the evening, take a lot of fruits, lot of roughage, and actually boil things, which will keep us. Two things are there. Obesity will not be there. All the heart cases will not be there. So, I think to have a good health, Ayurveda is, so I shouldn't talk much about Ayurveda, it's very, very helpful. Because I personally feel I never feel cold. I never wear a sweater in these winter days. I'm just like this because that honey gives me a lot of energy. So I request all my friends to please take some Ayurvedic medicine to keep themselves healthy and aging gracefully also.